Hi, Andrea. It's nice to see you again today. I have good news for you. You did the right thing by coming in. After looking over your exam and the results of the series of tests that we did and the x-rays, I feel confident that what you have is treatable with chiropractic care. So the good news is you are in the right place at the right time. Now, because what you have is a chiropractic problem, I just want to take a minute to go over the important facts about chiropractic. So on this sheet here, you saw a lot of this on the video yesterday, that chiropractic, it's not new. It's not experimental. In fact, it's been around for more than 100 years. So just like anything, if it didn't work, it would have disappeared a long time ago. But the opposite's true. It's actually now the second largest healing profession in the Western world. And all this kind of points out to the bottom that WebMD did a study, and they followed 2 million patients over several years, and then surveyed those patients and found that chiropractic patients are 95% satisfied with their care. 95%. In the medical world, it's impossible to find a better record or that kind of success rate. So now we'll talk about your problem. Why are you feeling this way? Why do you have this pain? And first of all, it's not one thing. This didn't start the day that the pain started. This has actually been an accumulation of life's events that have happened over time. And we talk about treating children because it can actually start with the trauma of childbirth. You combine that with the hundreds of falls and accidents that you take as a child and a teenager, and all the repetitive things that you've done over your life. It's impossible to know all the improper lifts and all the wrong bends and lifts that you have made. That's why we say it's not one event, but the accumulation of life's events over time that have been hard on your structural system. So it's caused nerve damage, it's caused muscle changes, and it's caused tissue damage. So that's why I say it's not one thing, but the accumulation over time, that all this wear and tear. And as an example, imagine if you had never been to the dentist from birth until now. Nothing to your teeth. Can you imagine what your teeth would look like? Right, probably not good. Or how about, let's imagine having the tires in your car where you never aligned or balanced the tires in your car. A blowout is inevitable. So through the years, you have had an innumerable amount of nerve damage, and really, you're fortunate, that you're not in more pain than you are. So we'll flip to this next page. What is the result of all this untreated damage and activity? Well, your spine has been pushed and pulled out of its normal position, causing compression on those discs, squeezing them closer together and pinching the nerve. And the technical term for that is called the subluxation. So if you study this chart here, you can see the different regions of the spine that these subluxations can affect. So in your case, if we look down here, it's causing your middle back pain, and it's causing your low back pain even into your legs. So what's fascinating is that the brain communicates down the spinal cord and out all these nerves. Well, if there's a disconnect or miscommunication, those nerves can't function like they should. The brain can't communicate its commands, so the body doesn't function at 100%. It's kind of like if you turn on a hose, a garden hose, and water doesn't come out. You would look to see where there's a kink or a pinch in that hose so that the water can flow again. It's the same idea with your nervous system. So that's how the nerve flow is stopped and the communication is cut off, and the result is dis-ease. So there are 4 stages of degeneration. And much like any disease, the longer you let it stay there, the more severe the health problem. So right now, I would place your lower back in phase 3, which is moderate degeneration. So I'm going to show you your x-rays, and I'm going to show you what I'm talking about. So on your x-rays, we can actually see that you have a misalignment at the lowest part of your lower back, and it's actually, we can see between the lowest part and your sacrum here, that you have a loss of that disc space, and your pelvis is unlevel, and that's what's causing your pain. Also, we look at your neck, and you can see that you have a sliding forward of that vertebrae. You see that vertebrae is not supposed to be there. It's supposed to be stacked on top of those other ones, and that's what's pulling that muscle and irritating that nerve. So I've spent some time now describing the problem. Does this make sense to you? Okay, so the important part then, the part that you really care about, what do we do? The solution. And the solution is the adjustments. So just like this didn't happen overnight, we're not going to be able to fix it overnight either. We're going to do a series of adjustments. And just like if you go to the orthodontist and get your teeth straight, it takes some time and it takes some repetition. And it's the same thing here. You don't expect the dentist to fix your teeth or straighten your teeth in one visit, and that's not going to be the case here. It's going to take more than one visit. But eventually we're going to get those back into place and by retraining these muscles. So that's exactly what we have to do. We have to retrain. So because your body has actually spent some time thinking that the wrong place is the right place, and that thinks that that's normal. So we'll adjust your spine, and most likely it'll adjust back. So for every 3 steps forward, we take 2 steps back until we retrain and get your spine into that corrected position. So what I have here, what the plan here is that it's essential that you follow this to a T, that you don't miss any of these appointments, because it's the number of treatment and the timing that's what's going to get you back to feeling good, and it's going to be essential for your restoration. All right, so I've divided the plan into 3 parts. The first part is pain, and the pain that's our primary goal. We want to get you feeling better. Every person will respond a little bit differently, but in your case, we're going to do 3 times a week for 3 weeks. And I feel confident by the end of the stage that you're going to be feeling really good. But it's essential that we go to this next phase, which is called stabilization. Before we get to that phase, however, we will be doing a progress exam, making sure that you're ready for that stage. And then once we get there, we're going to be doing 3 weeks for 2 times a week. So we want to stabilize that condition. It'll be fragile at this point. Any little thing could set you back, and we don't want that to happen. So we will be stabilizing and making sure that you're holding in that position. Again, we'll do another progress exam, making sure you're ready to go to our last and final stage, which is prevention. And prevention is what's essential for your health and for your wellness. It's preventing these problems from happening all over again. We're not going to expect you to stop doing what you did to cause these subluxations. I know that you like to work out, and I know that you like to work. So just like after you get your teeth cleaned, your teeth don't stay clean. That's just not going to happen. So it's the same thing here. We're going to have to maintain your spine so that this doesn't continue to cause problems and continue to cause some degeneration. So we always say that wellness care is better than sickness care. It's always a lot cheaper to do prevention than to do overhaul, right? So wellness is what you want. Wellness is what you need. But in order to get you there, I'm just going to just go over a couple more things. We write this on everybody's plan, and like I mentioned, it's essential that you make all your appointment times. We understand people get busy. If you need to reschedule those appointments, we have plenty of times. We ask that if you miss an appointment, you make that appointment up. And secondly, we ask you to attend our How to Stay Young class. It's about a 20-minute class we offer right here in our reception area. It has some really essential information, some information I promise you've never heard before. And we have some tickets here in your folder for you and your family. And we offer it every Monday, and we offer it every Wednesday. Mondays at 12:15 and Wednesdays at 6:15. Already, what time do you think when we make this, what would be a better day for you, a Monday or a Wednesday? A Wednesday at 6:15. Okay, so I'll just indicate that would be the best time for you, so that when we do schedule, we'll make sure you're scheduling for that class. And then again, we have these slips in here to bring along your husband and bring along your daughters. I know they'd find this information valuable as well. So unless you have any questions for me, I'm ready to get started with your care. Are you ready?
Yes.